Hey everyone, and welcome. Today, we're going to break down a protocol that's designed to make one of those really critical high-pressure tasks in the ICU, dosing noradrenaline, so much safer and simpler. Let's jump right in and see how this system can help you ditch the complex bedside math and really boost your confidence. So, here's our game plan. First, we'll talk about why standardizing is such a big deal. Then, we'll get into the two standard concentrations that are the core of this whole system. After that, I'll walk you step by step through preparing an infusion. And then we get to the best part, the simple conversion trick that makes it all click. And finally, we'll wrap up with some crucial safety reminders.
All right, first things first. Why are we even talking about this? It's really all about moving away from those stressful, on-the-fly calculations at the bedside where it's so easy to make a mistake, and shifting to a system that gives you accurate, confident care every single time.
I mean, we've all been there, right? You're in a super critical situation, the pressure's on, and you're trying to punch numbers into a calculator for a complex drip rate. It's stressful, and honestly, it's a major risk for error. This system is designed to completely eliminate that problem.
So here's the big goal. What we want is a super simple, straightforward link between the number you're setting on the infusion pump, your milliliters per hour, and the actual dose the patient is getting in micrograms per kilogram per minute. That's it. No more frantic calculating. Next up, let's look at how this thing is actually built. And the whole thing, the real beauty of it, is that it's all based on just two standard weight-based concentrations. This is the foundation that makes all the easy mental math possible.
And this slide lays it out perfectly. You've got two clear options for two different situations. For your routine titrations, you're going to use the low-dose prep. But when things get really serious, like in septic shock, or for patients who need a lot of pressure support, you've got the high-dose option. Notice they're both diluted in 50 mils. The only difference is that tenfold change in the formula.
Okay, so let's get our hands dirty, right? Let's talk about actually preparing the infusion. We're going to walk through this nice and slow using the low-dose formula as our example, so you can see exactly how it works from start to finish. It's literally just 4 simple steps. We're going to use a hypothetical 60-kilogram patient to make the math totally clear and easy to follow.
Okay, step 1 is easy. We just need our patient's weight. For this whole example, we're going to say our patient weighs 60 kilograms.
Now, we're going to combine steps 2 and 3 and apply that low-dose formula. So, we take our patient's weight, 60 kilograms, and we multiply it by that key number for the low-dose prep, which is 0.03. And boom, that gives us our answer, 1.8 milligrams. This is the total amount of noradrenaline that we need to add to our 50 milliliter bag for this specific patient.
Now let's think about what this means in the real world, at the medcard. Each standard ampule has 2 milligrams of noradrenaline. Since we only need 1.8 milligrams, we're just going to use 1 ampule. It's that simple.
All right, here we go. This is the big payoff, the aha moment that makes this whole system an absolute game changer. Once you've prepared the infusion correctly, the rest is unbelievably easy.
And here it is. It's so simple, it's brilliant. For that low-dose infusion we just made, you just take your pump rate in mLs per hour and divide it by 100. That's your dose in mics per kilo per minute. For a high-dose infusion, you just divide by 10. That's it. No calculator, no complicated math.
And you can see exactly how this plays out on this chart. Let's say your pump is running at 5 milliliters per hour on a low-dose prep. Well, you just know the patient is getting exactly 0.05 mics per kilo per minute. If you're on a high-dose prep running at 20 milliliters an hour, they're getting 2.0. It's a direct one-to-one conversion you can do in your head.
So you might be wondering, how can this be so simple and still work for any adult patient? Well, the magic is all in the prep. Because you already did the weight-based calculation when you mix the bag, these simple division rules, divide by 100 or divide by 10, will give you the right dose every single time, no matter the patient's weight.
Okay, so we have this amazing, simple system. But of course, a great tool is only as good as how we use it safely. So let's wrap up by going over the essential best practices that make sure this protocol is safe and effective.
So let's just run through this safety checklist. These are absolutely non-negotiable. First, you have to label that syringe clearly, low dose or high dose. Always note the date and time of prep. You're going to start low and titrate up to your target blood pressure. And every time you change the rate, you've got to document the dose in mics per kilo per minute, which is now so easy to do. And of course, follow your standard safety rules. Never mix it with other drugs and use a central line whenever you can.
So I want to leave you with this to think about.
When you take all that complex, error-prone math out of the equation, how is a system like this going to change your day? How will it not only make things safer for your patients, but also reduce your stress and streamline your workflow in those critical moments?